Well, with almost 100 registrants on the call tonight, I think it's time to get this webinar started. So my name is Sheldon Collins. I am the Managing Director at Private Practice Solutions. We are a full solution provider to aesthetic providers. And in particular, if you're looking to buy a Rohrer product, you would contact the phone number listed on the slide there and speak to one of our representatives. Tonight, we're very honored to have two doctors on the call, Dr. Fred Fedek and also Dr. Mark Beatty. Dr. Beatty is going to be talking about the Phoenix, the CO2 device made by Rohrer Products and sold by us, which has a cutting hand piece of vaginal add-on, a scanner, and also a hand scanner. Sells for $44,995 plus add-ons and comes with a 2-year warranty. Dr. Fedek, who is the president of the American Academy of Facial Plastic and Reconstructive Surgery, also has this device in his office. Is going to be speaking about the efficacy of using the Spectrum and all of its modalities, which sells for $54,995, comes with a 2-year warranty. And I think the best place to get this webinar started, Dr. Fedek, is if you could start in just on hair removal and what your experiences have been using that handpiece, and then maybe move through all the modalities.
This is very good. And just once again, for those of you that may not do a lot of laser hair removal, what you do is you have to treat them about 6 times with the treatment times separated by 6 or 8 weeks. And then you retreat it, because you have to keep in mind there's only a percentage of your hair follicles that are active at any given time. And then once you get through that additional treatment schedule, you then just treat in a much reduced, like, yearly schedule to keep things away. This is one of the patients that my wife has been treating. She just wanted, so you could use this very focally. She just wanted to change the way her sideburn is, and this was just after like 2 treatments right here on this young lady. The erbium YAG has a lot of utility. Thing to know about erbium laser is it has about 10 times the affinity for water. The wavelength of it has about 10 times the affinity for water that a CO2 does. So what does that mean? That means it's absorbed more quickly in the skin, and as it says here in the text, that the top layer of the tissue is ablated, and then you have some heat put to the dermal tissue. What you can do with this is you can do some mild to moderate resurfacing, and what you do is you save on a lot of the downtime, because it doesn't penetrate as much as the CO2, and this will do more to the surface itself. So what is this good for in terms of facial aging? This is absolutely great for the patient who has a lot of brown spots, a lot of lentigines, a lot of sun damage, and you want to get some modest skin tightening also. It will not give you as much skin tightening as the CO2, because it doesn't penetrate to the dermis as thoroughly, but it'll do a good job for you. And the key, I've had this done on myself, is it'll reduce your downtime. This is about time frames. This is realistic, and what happens on day 2 to 4 and 5 really depends on the amount of energy you use, but this is a reasonable time frame. And the punchline is you heal up quicker than you do after a fractional CO2, or certainly an ablative CO2. These are very realistic results here. If you look at this, this is the technique here is pretty good in terms of photographic technique. These are real results. And what you see on this patient, you see a fairly good resolution of some of the periorbital wrinkles, as well as some smoothing of the skin, a little bit of overall tightening. Once again, not what you get on a CO2, but what you'll do is you'll save the downtime, and this is very, very good on the younger patient. This is why I like erbium for this kind of patient. You see on the pre-op is you see all these brown spots, and you see how those are cleared. And what I would submit to you, even if you have a CO2 laser, you would want to use this on top, the erbium on top of it, to do at times a better job on some of these surface lentigines. Same patient here. This is what I love the erbium for, to take care of these brown spots, hyperpigmented spots. Once again, here's another patient, reasonable results, well represented results. different photographic technique, and you should always look critically at these pre-op, post-op. But given what we see the changes, particularly the brown spots, this is a very genuine depiction of what can be done here. The Q-switch YAG is what's largely touted to be used for tattoo removal. The ND-YAG can be described the gold standard for tattoo removal. It is what the world's experience in tattoo removal. It's where the most experience is and probably the most versatile wavelengths. And with the frequency doubling, you can change the wavelength of this from 1064 to 532. This is a good depiction. A 1064 is largely used for darker colors, and that'll work quite well with blues and blacks and stuff like that. And this thing is awesome in that color spectrum. The 532 is for lighter colors, especially things like reds and things like that. It'll work quite well. And there's a few, just a little bit of basic science. How tattoo removal works is like this. The dye is affected not only by heat, the thermal changes in it, but there's also essentially a photoacoustic shock to the pigment caused by the laser, just high energy photons. And what happens is as you treat the tattoo, what you see first sort of immediately is sort of like a whitening, and that's actually micro bubbles of gas after the impact of the laser. And then afterwards you'll actually see the pigment yet, but over the next few weeks or months, as whatever your own macrophages will remove the dye. To keep in mind, all laser tattoo removal honestly takes much more than one treatment. And this is after a number of treatments, and then this is some additional treatments. It is very difficult to completely remove all the pigment with any platform, and it depends on the colors used, but this is a good depiction of what this laser will do. Key here, this looks downright very impressive here between this pre-op and post-op. What's the key here? Look at that pigment. That is, 1064 nanometer target dark pigment, and that's why the result's so nice. IPL is different. IPL is not laser. IPL is an intense light that people discovered will actually affect pigment in the skin, and also you can remodel collagen with it. How it works is, as opposed to lasers essentially having a very narrow bandwidth, like 1064 or 2940 or so, IPL has actually a bandwidth of light. And this is created in this handpiece by these various filters, which are magnetically attached to this handpiece. This also has cooling in the handpiece, and you use this thing using a gel also to try to couple the filters to the skin. And this is the term, it's selective photothermolysis, and depending on the wavelength, it depends. That's what determines what the target is, what the chromophore is. It's certain, the one filter will target hemoglobin and hence is good at removing vascular-like lesions or red things. And other filters will affect melanin. There's wavelengths on here to help with even hair removal and skin tightening also. There's filters that do that. They don't do them as well as like the 810, but you can do it. And the key with IPL is people generally need multiple treatments, but they're relatively mild in terms of downtime. And this is something they can do early in the day and go back to work. Here's an IPL treatment, and the target here is the severe cystic acne here. And with a red filter here, you can help dry up and obliterate that acne. Here's a younger patient also with acne.
Fred, I'm sorry to interrupt. Let me just jump in on that one, because that actually is my patient, and you're correct that we use the red filter, but this is Dr. Beatty, by the way. What we also did with that, and we've had good success with this, is using the 450 nanometer cutoff filter to help improve some of her, not really for the cystic acne, but for the more, run-of-the-mill acne vulgaris. That targets the acne pyogenes bacteria, and we've had good success in a variety of patients that have had refractory acne, treating in that fashion as well.
Okay. Thank you, and that's a nice result also. Here's another patient where an acne filter was used, and you could see good clearing. And I've done this myself. This is not my patient, but it's very effective. Also another patient here, and what you can, this is really more with acneiform rosacea. It actually looks more like, and so IPL, it's very popular in treating rosacea. And it's one of the well-known treatments for rosacea as well as acne itself. And you can also use it for vessel disorders like poikiloderma and things like that. This is another patient. This is with telangiectasias. This is a reasonable treatment with using the IPL. I'll show one of my own patients with this. What I'll do with this, I'll use IPL on this, and also during the same treatment, I'll use a long pulse YAG for some of the bigger the vessels here. This is a patient. Is this your patient, Mark, at all?
One second, I just had to unmute myself. Yes, it is. So this is basically what we were treating here. Well, you can go back to that. So basically what we were treating here is all that pigmented stuff along the jawline and the neck. This guy is a sailor and spends 3 months out of the year in the Caribbean and comes back, with a substantial amount of hyperpigmentation each time. And, 3 to 4 IPL passes clears it up for him until he's back out on the water for 3 months, and then we do it again.
And so then that was a brown filter.
Correct. That is correct, yes.
And so this is my patient here, and actually for this bad sun damage on the décolleté, I really don't, you could do this with an erbium per se, you could get this result, but as something that has limited downtime and you work through, this is literally after one treatment on this using the IPL brown filter on this gal. Okay, so the long pulse YAG, that's works very well on facial veins, both veins and also small capillaries on the face. This also is a cooled handpiece. The cooling mechanism is right at the end there, and what it does basically, it penetrates through the skin and is absorbed by the hemoglobin in the vessels. The vessel heats up, it gets damaged, and then it obliterates. You can actually follow this as you're doing this exactly, and this is what you can do with this. If this is on somebody's, literally if this is on their thigh even, but if this was on their cheek, what you do is you use the long pulse YAG, and you just follow paint right along the vessel here, and you can watch it obliterate, and you can adjust your energy so that you essentially get no surface irregularities, but you just get the vessel. Sometimes you have to retreat them if they recannulize, but this is very effective for small vessels. This is a small spider angiomata, and I could expect getting this result with one treatment and just popping that once or 2 times with the long pulse YAG. Similar here, you just paint right along, follow the vessel, and that help takes care of that. This is my patient, and this is a patient that was treated with both IPL. This is just like one treatment. Okay, so, and just with the whole area here would treat with the red filter and the IPL, and then for these bigger vessels here, at the same time, I would just paint right along that with the long pulse YAG. This is my patient also. This is a deep venous lake on his nose. There's that's actually a little bit of a depression afterwards. That's not because of thermal damage or anything. That's because this was space occupying. But just pop this a few times with the long pulse YAG, and it's completely obliterated. That was one treatment. What's good about the Spectrum, it's very reliable. It's fairly whole, lightweight unit, and you can take it apart, and it's made to be transported. So you don't have to, you don't have to be overly cautious about transport it. It's made to come apart like that. You can transport it from one office to office. So what's good about it? You really cover a lot of different things, a lot of different clinical situations that you want to be able to cover if you're offering laser services, and it does it in a very reliable and wide use kind of package, and it's literally affordable. Like I say repeatedly, people, when I'm at a meeting and a former resident, comes up to me and tells me they just paid $200,000 for a laser, I ask them what's the matter with them. They'll never pay that thing off. These things work very good for us, and we use this laser in our office several times a week, and we have this since Mark first introduced that. So with that ado, we'll take questions at the end of this. I'd like to introduce Dr. Mark Beatty, who has also already chimed in, and I'm going to turn it over to him right now.
Okay, great. Thanks, Fred, and good evening, everybody. So what I'm going to speak to is another product from Rohrer Aesthetics. This is the Phoenix CO2 laser with the integrated SwiftScan scanner, as well as the hand scanner. And then at the end of the presentation, I'll talk about yet another application with the Rejuvenate handpiece. So back to the concepts of what to consider when purchasing lasers. The things that are important to me and that I've found useful really for all technology is 4 primary things. Number 1, does it accomplish something that your patients want? You can have the greatest device on the planet that works absolutely perfectly, and if it doesn't fit into your practice or accomplish something that your patients want or are asking for, it's completely useless to you, and it's going to be a disappointment. So for us, I'm a facial plastic surgeon. We are a very surgery-centric practice, but over the years found that patients were demanding solutions that allowed for efficient and effective skin resurfacing with minimal downtime. And that was where I started considering different laser platforms and started working with the Rohrer folks. Second thing, of course, is does it work? And Dr. Fedak spoke to this earlier, as did Mark. Your technology has to be up to current gold standard, or patients aren't going to be satisfied with the kind of results that you get. Reliability is huge, and that goes hand in hand with the amount of the type of service that you get from the technology providers. Perhaps reliability of your laser isn't quite as important as reliability of the harness on your zip line, but I can tell you from experiences with other technology, it's pretty darn embarrassing when you're in the middle of a procedure with a patient and the device breaks down. That can be quite problematic. And then finally, is it affordable and does it produce a favorable ROI for you? Because ultimately that is what is going to keep your business healthy and your patients happy. So how does the Spectrum fit in to this? Well, first of all, while it is entirely a CO2 device, it is set up with multiple handpieces and scanning technology that allow it to perform multiple different functions. With the cutting handpiece, it can be used as an incision and excision tool. It's available with both continuous wave and super pulse modes, which allows you to use it both as a cutting instrument and as a cut coag hemostasis on the fly kind of instrument. This is what the touch screen looks like, the control panel. I find this very intuitive, super easy to use, and settings can be changed on the fly, as well as stored in memory, which makes it super easy to use even by yourself. as for treatments. So what do you do with things like this? Well, here's an example of using the laser as an incision tool for blepharoplasty. Probably for me, the most frequent time that I would use it as a cutting tool is for doing lesion excisions and scar excisions. I usually prefer steel for things like blepharoplasty, but it's quite effective as a tool and works very efficiently. The thing I really love it for is skin tags, warts, moles, those things that, you know, when you do them with a knife and then go back and secondarily cauterize the bed, that can this can take quite a long period of time, and it speeds up that type of work immensely. And so just really enjoy using this as a tool for those types of treatments. But the mainstay of what you're going to use your CO2 laser for is going to be for skin resurfacing. The Phoenix is adapted with a fractional scanner. I'm sure everybody is familiar with how this works. Basically, the strategy is that you are intentionally leaving untreated islands of skin between the treatment points. That allows for significantly faster wound healing and recovery than when we were doing fully ablative CO2. It also allows the treatment depth and level of aggressiveness of each treatment point to be greater since you're leaving intact islands of skin to heal in between. The adjustability of the scanning device is quite significant. So you can by changing the power settings and pulse duration on your treatment points, as well as the pattern density of the scanner, you really can go the full spectrum from a very light, almost like a glorified microdermabrasion, to a near fully ablative treatment with this laser. If you'll notice on the control panel as well, there's a selection of a number of different pattern shapes, square, circular, triangular, rectangular, and pattern sizes, which makes it pretty easy to deal with treating the multiple irregular contours of the face. And I generally find, there's a learning curve with everything, but I can generally do a single pass entire face inside of 30 minutes with this device. Again, memory settings are on there. The control panel is quite intuitive, so I have found it quite easy to use, and my senior laser tech who works with this as well likewise has found it to be quite intuitive and easy to use. Excuse me. Some examples. Again, treating mid-face and peri-orbital area for fine lines and wrinkles. Also, nice ablation on the forehead of some ensconced wrinkles as well. Even on thicker skin, male skin responds nicely. This is a single treatment with a fractional CO2 with, I think, very nice clearance and of wrinkles for the entire face, as well as having a significant effect on pigmentation. I do agree with Dr. Fedek that the erbium laser is a nice addition for people with pigmentation issues, and I will commonly use both of these lasers together as he described with the erbium treatment on top of the CO2 treatment to further affect the pigmentation. I did not do that on this particular patient, but that is an effective strategy. And then some other examples of the type of result that we can see. And I think compared to erbium here, you see that we're having an effect on pigmentation, but a much greater effect on lines and wrinkles. And that is the result of treating significantly deeper with each of your penetration of each of your treatment points with the CO2 laser. And it's a super effective tool and relatively rapidly healing with most people. being able to be healed and back in makeup in the 7 or 8 day time frame. There also is this is a very innovative little hand scanner that the Rohrer laser has, and we love this thing. It comes with the laser. You simply attach the treatment head to the hand box, and it has a separate control panel for doing the hand treatment. This can be done for pigment and texture irregularity on the back of the hand. Many of my patients find that after their facial surgery and facial treatment, the giveaway that they have for their aging changes is their hands. And we've had good success using injectables for treating thin skin and showy tendons and vasculature, but that still leaves the pigmentation and skin texture problems. This treatment can be done in literally 30 seconds per hand. I usually treat people with no anesthetic at all for this. Some people require a little bit of topical. I treat myself about once a month, and it really does work quite quickly. And
Mark, can I comment on that? Yeah,
yeah,
for the
please.
hand. Yeah, this, my practice is truly, 99% facial. But this is a very popular add-on thing we do in our practice. As Mark says, patients actually love this. I think this rejuvenates their hands, and we will do their portions of their arms with this. And I think it rejuvenates things better than injecting the dorsum of their hands with, any materials, because it helps the pigmentation and it will tighten the skin.
Yeah, exactly. I think it does a different thing. So I often will treat concurrently with injectables plus using the laser. But yeah, the effect on pigmentation and then skin texture and skin tone is fantastic. And this is another thing, just from a how you use it in your practice standpoint. This is something, because it is so quick and easy to do and so well tolerated. This is a very easy add-on to throw in, and we'll do that frequently if I'm treating somebody, say, with a CO2 resurfacing for their face. We'll just do their hands as part of it, and generally folks will love it and they'll come back for retreatments. And that's worked out quite nicely. So we've really liked this. And this is the type of result that you can see with this. You can see very nice clearance of the pigmentation issues, and this is after 3 treatments. Another example after 3 treatments. But this is what we see all the time with this device. So it really works quite well. So those are the more traditional and common uses of the CO2 laser. But I do want to speak for a moment on the vaginal rejuvenation handpiece, which is something that we have added within our practice as well. My wife is primarily doing these treatments. She is a family practitioner with a great deal of experience and a large patient population in the perimenopausal range. And we have found this to be a very effective adjuvant or even replacement in some cases for hormone therapy in women in this range. So I'm not the absolute expert on this, but I can at least go through it in overview. Basically, what you tend to see in aging women is vaginal atrophy. There are some actual cellular changes that result in thinning of the vaginal mucosa and the loss of mucus glands. So that then leads to dryness, irritability, itching, and a tendency to more easily tear, just like thinning mucosa anywhere else. And this is hormonally related in the period after menopause, and traditionally is treated with hormones quite effectively, but this requires using them. Many of the strategies are creams and things which are messy and they're expensive. just more of an example of kind of the histology of the thinning vaginal mucosa. Clinically, this is what you see. You tend to get some constriction and thinning of the labia and the vulvar. The introitus can sometimes narrow. You're losing intravaginal moisture, and all of those things work together to cause problems ranging from irritation and itching to frank dyspareunia and loss of enjoyment in sex. So again, the listing here, I think to me the most important thing here are the things you see in these women: burning. People sometimes think they have urinary tract infections, itching, dyspareunia, and the pathophysiologic changes that go along with that. So this gives you an idea of how much thinning you can actually see in these women, with the superficial mucosa diminishing from approximately 15% of a healthy vaginal mucosa to less than 5% in more severe vaginal atrophy. So this is the handpiece for the Rejuvenate device, and the cartoon on the right, this actually is showing a transvaginal ultrasound, but this is exactly how the handpiece with its cover is inserted. There's a close-up of the handpiece, and then again the control panel, which is similarly designed to the others we've spoken about. And are quite intuitive. And then there's a sterilized plastic sleeve that fits over the laser treatment head, and you use obviously a new one of those for each treatment. This is a patient of ours that my wife treated in just a little brief video. Let me run this, and this will give an idea of the type of results that we see.
Anyway, there is no pain in the process at all. You just don't feel anything, so it's not a big deal, and the results are amazing. The severe dryness that I experienced for years is now gone. It is. It feels really good. It feels really good to have lost, because you forget how good some things can feel, and you forget that dryness is an irritant. So I'm extremely pleased. This is going to be the third treatment, and in the last two, I continue to see increased moisture on a regular basis. It is really, really nice. I could, if I had known about it, if it existed years ago, I would have done it.
So that pretty much sums it up. And actually, the other piece that our patient mentioned at the beginning of this that I had neglected to talk about, this procedure for the internal vaginal part of the treatment is completely painless. There is no anesthetic required. Now, treating around the introitus, or if you do any external treatment for the vulva, that requires some topical anesthetic, but it is remarkable how well tolerated and how pain-free this procedure is. Our experience with this system, with just the CO2 laser, but certainly the Spectrum as well, these are systems that can be used for a lot of different procedures. They're quite diverse and fit a number of niches within your practice. I do think the technology is up to current gold standard. You will find that it is quite reasonable at cost level standpoint. Service for us has been impeccable. Number one, we've had very few issues in the year and a half that I have had these lasers, but anything that has come up, we've always been able to get an answer within minutes to an hour, and if we needed anything looked at, the company is great about getting people to us really within a day for anything that we've needed. And no consumables or disposables for any of these things, with the exception of the sheath for the Rejuvenate treatment. So that also helps to improve the ROI. And that is, I believe, takes us through my presentation.
Thank you, doctors, for sharing your experiences, and thank you, attendees, for taking your valuable time. And we look forward to meeting up with everybody that attended the webinar, and even those that are listening to it later on a recording, to take care of you and answer all your questions.